Hello friends, today we are going to discuss here about last 5 years questions from INI-CET examination surgery. Let's begin. Pancreatic pseudocyst. Best investigation is CT scan with contrast. Thyroid malignancy, RET mutation seen in medullary carcinoma thyroid. Varicose vein, most common complication is ulcer over medial malleolus. In breast lump, we use triple assessment like clinical imaging and FNAC. In exam, they like to ask accept. Okay. Acute appendicitis. The first structure encountered during open surgery is external oblique aponeurosis. GI stromal tumor marker positive is CD17, 117 and CK. Massive hemothorax indication for thoracotomy is more than 1500 blood initially or 200 ml every hour till 3 hours. Peptic ulcer perforation, commonest site is anterior wall of first part of duodenum or duodenal bulb, you can say. Ameloblastoma origin from odontic epithelium. So guys, these are the repeated questions in INI-CET exam they like to ask. Burns, the formula is Parkland formula, 4 ml into percent total body surface area into weight per kg in kgs. Sometimes they give you MCQ values, you have to calculate, or sometimes they like to ask formula. BPS surgical management refractory is TURP, transurethral resection of prostate. If medicines are not working, we use alpha blockers, or to reduce the prostate side, we use 5 alpha reductase inhibitors. They fail, go with TURP. Rectal carcinoma distance from low anterior resection is more than 5 cm from anal verge. Spleen injury grade 3. Management is conservative with serial imaging if stable. Grade 4 splenic injury, go with angioembolization. If failed, then splenectomy. Grade 5 complete shattered spleen, so splenectomy is indicated. Gastric outlet obstruction, most common cause is carcinoma antrum. Peripheral artery disease, best diagnosis is CT angiography. Okay. Initial investigation in this scenario is color Doppler. Breast cancer sentinel node biopsy used for staging. Esophageal perforation, common site is left posterior lateral wall lower 1/3. Carotid body tumor, Shamlin classification based on vessel encasement. Thyroglossal cyst surgery is cyst tongue procedure. Shock and trauma, most common cause is hemorrhage. What is trauma? Trauma is accident or you fall from height or assault. That is trauma. So bleeding causes hypovolemia and hypovolemia is a hemorrhagic shock. If an option hemorrhagic shock is not available, then go with hypovolemic shock. Thyroidectomy complication is hypocalcemia due to injury to parathyroid glands. Okay. If there is injury to parathyroid gland, we find hypocalcemia, tetany, or chaustic sign. Colorectal carcinoma, Duke's classification. Acute limb ischemia, there are 6 P's. Pain, pallor, pulselessness, paresthesia, paralysis, poikilothermia. Breast cancer receptor positive adjuvant is tamoxifen. Hydrated shifts liver agent is Echinococcus granulosus. Acute cholecystitis, Murphy sign is positive. We find Murphy sign. What is Murphy sign? Probe tenderness over right hypochondria, where gallbladder is located. When you put USG probe, patient find pain or you find tenderness there. Hemorrhoid best procedure for grade 3 is stapled hemorrhoidopexy. Pancreatitis, use Ranson's criteria on admission. Femoral hernia is below and lateral to pubic tubercle. Testicular torsion time for salvage is less than 6 hours. Less than 6 hours is a gold standard. After 6 hours, there is probability of orchidectomy. Before 6 hours, you do preserve the testes or do orchidopexy. Parotid tumor, most common is pleomorphic adenoma. Suture material absorbable, example is Vicryl. Varicose vein Trendelberg test purpose is to identify SF's incompetence. Esophageal carcinoma, most common type is squamous cell carcinoma. Due to GERD, the epithelium change into squamous to columnar, so there is adenocarcinoma, Barrett's esophagus, but most common is squamous cell carcinoma. Pneumothorax management, ICT placement at fifth intercostal space anterior to mid axillary line. Breast lump FNAC shows ductal cells seen in fibroadenoma. Burgess disease involves small and medium arteries but not large. Large vessel vasculitis is Takayasu or temporal. Gastric ulcer most common seen in lesser curvature. Post-iridectomy stridor is due to tracheomalacia. Abdominal trauma fast positive is laparotomy if unstable. Inguinal hernia indirect versus direct relation to inferior epigastric artery. Appendicitis McBurney's point location. Hydrocele test for translumination. Acute pancreatitis we find Gray Turner and Cullen sign. Gray Turner you found in back and Cullen sign around umbilicus. Okay. Breast cancer most common site is upper outer quadrant. Burn injury we see rule 9. Hematuria workup by CT urography. Intussusception target sign on ultrasonography. Image based question. Post-operative fever cause is 5 Ws. First W is wind, means atelectasis first and second days. Second W is water, means UTI, urinary tract infection after 2 days. And third W, fourth W, fifth W, these Ws are there. Okay, like wound or wonder medications, such type of pneumonic. Post-iridectomy hypocalcemia is due to Chostic or Trouser sign we found. These are trauma ortho soft tissue MCQ. Pelvic fracture with hypotension. Next step is pelvic binder and external fixation. Fast positive but patient stable, go do CT abdomen. Compartment syndrome, earliest sign is pain on passive stretch. Pain on passive movement you can say. Crush injury, risk of myoglobinuria due to renal failure. Clavicle fracture, middle 1/3 is the most common. Open fracture grading is under Gustilio Anderson. Long bone fracture with hypoxia and petechia is seen in fat embolism. Tension pneumothorax, needle decompression site is second intercostal space mid clavicular line. Okay. Emergency thoracotomy indicated when there is a more than 1500 ml initial blood. When you put ICD and immediately 1500 blood is coming out, need emergency thoracotomy. There is a one trick here. If blood is black or retained blood from last 5-7 days, then thoracotomy is not indicated. But fresh blood, fresh bleeding, fresh trauma, go emergency thoracotomy. If 200 ml per hour, 3 hours, cardiac arrest after chest injury. Flail chest, paradoxical movement of segment. Most common site of peptic ulcer is first part of duodenum anterior wall. Gastric ulcer, biopsy from ages of ulcer. Curling ulcer is a burn patient, seen in burn patient. Cushing ulcer in head injury or raised ICP. Painless hematoemesis seen in esophageal varices. Achillea cardia investigation is manometry is gold standard, or beak bird image on X-ray they give you. Borev syndrome is a rupture esophageal after vomiting. H. pylori positive ulcer is antral predominant gastritis. Most common cause of small bowel obstruction in India is adhesions. Colonic carcinoma, left versus right differences, left obstruction and right we found. anemia. Now, vascular and varicose. Burgess disease seen in young smoker distal vessels. Raynaud's phenomenon is a triphasic color change. Varicose vein complication is venous ulcer over medial malleolus. Trendelberg test is for check SFJ incompetence. Brody's Trendelberg operation ligation of SFJ. Type of shock is hypovolemic, cardiogenic, distributive, and obstructive. Best early indicator of shock is tachycardia. Resuscitation endpoint when urine output is more than 0.5 ml per kilogram per hour. Massive transfusion complication is citrate toxicity, which causes hypocalcemia. And DVT prophylaxis, we give low molecular weight heparin. Now, sebaceous cyst lined by stratified squamous epithelium. Lipoma, most common benign tumor of soft tissue. Pyogenic granuloma, lobular capillary hemangioma. Melanoma, depth measured by Breslow thickness. Basal cell carcinoma, local invasion, rare metastasis. Squamous cell carcinoma, most common malignant skin tumor. Marjolin ulcer is a squamous cell carcinoma in chronic scar. Pressure sore is common site sacrum. Keloid extend beyond wound margin. Wound healing phases inflammation, proliferation, and remodeling. Now, most common benign breast tumor is fibroadenoma. Carcinoma breast, most common type is invasive ductal carcinoma. Peyote orange due to lymphatic obstruction. Paget's disease of nipple associated with underlying carcinoma. Most common site of breast cancer is upper outer quadrant. Triple assessment is clinical imaging and FNSA. Breast conserving surgery contraindicated in multicentric disease. Axillary tail of sequence is a part of breast extending to axilla. Sentinel lymph node first draining node. Lymphedema post mastectomy due to lymphatic obstruction. Now, head and neck and thyroid. Recurrent laryngeal nerve injury results in hoarseness of voice. Thyroid malignancy with amyloid stroma is medullary carcinoma. Post-thyroidectomy stridor is due to tracheomalacia or bilateral recurrent laryngeal nerve palsy. Parotid tumor with facial nerve involvement is malignant. Warthin's tumor, also called adenolymphoma. Superior thyroid artery ligation endangers external branch of superior laryngeal nerve. Thyroglossal cyst moves with tongue protrusion and swallowing. Cold nodule on skin, next investigation is FNSA. Hurtle cell seen in Hashimoto thyroiditis or follicular neoplasm. Lateral aberrant thyroid is metastasis from papillary carcinoma. So guys, if you want more subject wise last 5-year previous MCQs, do comment this video, do subscribe this channel, and do share this video. Thank you.